Good morning. Delamar in for Elias just for today. He's back on Monday. This headline caught my eye. Is Quebec paying twice for healthcare? Joining us now is the Vice President of the CSN, David Bergeron-Cyr. Hello, David.
Hi.
Thanks for joining us.
Thank you.
So I take it by this headline you mean the reliance on the private sector to help ease congestion in the public sector. So that's where the double dipping comment comes in from. How much are we spending on private healthcare to help ease the public system right now?
Only in the last year we spent $6 billion in the private sector, and on top of that is that we calculated that if those services would have been offered in our public sector, we would have saved $700 million.
Okay. Now, the services are available, of course, but I think there's long lineups, suboptimal long lineups. They're affecting health outcomes in some cases. That's why the government is resorting to this. Do you think it's not enough of an emergency to rely on the private sector?
The thing is that the private sector is not the solution. There is an emergency, of course, but the private sector is not the solution. For 30 years now, that's what are the different parties or governments that we had in Quebec are saying the same thing. We need privatization. We need, because they're gonna be a club complementary to our public sector, but it's false. They are a competitor. And the thing is that we've been doing that for 30 years, and nothing has improved. So you have waiting lists for your family doctor. You have a waiting list if you want to have chirurgy. So emergencies, the waiting hours are getting longer and longer. So what's affecting our public sector is that on top of the privatization, they are not putting the minimum money that we need to cover, salary of the employee, equipment, paint on the walls. The minimum is not there for the last 30 years. So that's normal that the public health care is suffering.
In terms of relying on the private sector, I mean, we're talking about people, again, who may not have time to wait for all this procurement and for the institution to expand and for more nurses to be hired, for more doctors to be hired. So they are either paying out of pocket for a private clinic or hopefully getting a subsidy from the government to do the same.
Yeah, but, we cannot look at this as individuals. And of course, people are, they're living like real nightmares. Health is something that's very important, and I don't blame anyone that's deciding to go to the private sector because of health issues. But if you look at it globally, are we getting better? No. So that's the point. We have to find a solution for everyone. When you consider health, you cannot only consider yourself as an individual. You have to look at the environment where you work. You have to look at the climate changes, which will be the bigger factor on our health in the years to come would be climate changes. So we have to think in the matter of prevention. How can we do that people are getting less and less sick instead of just thinking about how we're going to treat them? And the biggest lie with the private sector is that it's a blood-sucking vampire. They are taking all the employees, all the money, all the professionals that we need in the public healthcare system. So that's why we're saying that it's not going to help, and it didn't.
I'll give you my personal example because I want to push back on the idea that this is, that there isn't an urgent need here to rely on the private sector. For me, I was diagnosed with a relatively minor inflammation issue in the public system, and I did the math because they called me back for the appointments in the public system after I already booked in the private. So I have a very, very specific idea about how long it would have taken public versus private. Public, all said and done, to fix my problem and to get back to work full time, starting last Christmas, it would have been almost a solid year. It would have been a year of suffering, right? On and off. Private sector, I was in and out, solved the problem, got my diagnosis, and knew how to work from there in 3 months, right? And I own a small corporation, so that the difference between being out for 3 months and a year is the difference between my business succeeding and failing.
Yeah, absolutely. And we could be able to do the same thing in the public sector like it was before. When I was a kid, I had a family doctor. How come right now I can have a family doctor for my kids? What happened? What happened is that we have politicians who are businessmen, and they don't believe in the values of a public, free healthcare system. And they have been destroying it for the last 30 years because there's also doctors that are businessmen, and that's what they're doing. So it's if we need to treat more people, we need the employees, we need the professionals, we need the les salles d'opération. So if we let that go to the private sector, we're not going to help the public sector. And on top of that, is that I lost my thought. Language barrier.
No worries. So, in terms of how to change this going forward, not a lot of talk at the federal level. Obviously, it's not federal jurisdiction. But would you ban private clinics? I mean, do you want to go all in 100% on the public system? And don't you think that's putting all of our eggs in one basket?
Yeah. First off, you have to understand that those two systems cannot coexist forever. Okay, at some point, one's going to destroy the other one. And in the private sector, don't forget that if you have the money, good for you. But a lot of people are going to get in more debt because they're going to be treated in the private sector. And on top of that, in the United States, that's the first reason of death for individuals is health. Mm-hmm. So, and there's 40 million people in the United States that don't even have insurance. So imagine, that's why I'm saying we have to think about a global solution, and not only for some individuals that find a way to get there, which is I totally understand because healthcare is so important and we don't want anybody to suffer. But we have to find a global solution. Now, what we are putting forward now is, first of all, can we stop letting the doctors go to the private sector? We have in Quebec 800 doctors that work in the private sector. You know how many there are in the rest of Canada? Not even 20. So in all the provinces, not even 20. So we're not protecting our healthcare system in Quebec. Why? I said the answer earlier. Our prime minister is a businessman. Our healthcare minister is a businessman. That's how they see life, So. Okay. The second thing
we got to run. I'm sorry, we have to run. We're over time, but I appreciate your perspective today. David Bergeron-Cyr, CSN Vice President. We'll have to pick this up again soon. Thank you.
Okay, thank you. Have a nice one.